Hello, in this video, I'm going to give you my top 10 tips for student nurses on placement. So, before you even start on placement, my first top tip would be to make sure you contact your placement area before your first day. If possible, arrange an in person visit, but if not, give the team a call or send an email. You will need to find out the shift pattern, what you'll be working for at least your first day, and what the uniform requirements are. My second tip is to do research. Look into the placement area as much as possible. What does the area specialise in? What medications are commonly used? Has the team won any awards in the past? If it's a placement area where you might see, just for example, a lot of nasogastric tubes being used, look into how this is carried out before you go. Nobody expects you to be an expert on anything as you are there to learn, but if you have a general awareness of some of the key areas, it will give you a head start and really maximize your learning opportunity. My third tip is plan. How are you getting there and back? What time do you need to get the bus? How much is it going to cost you? If you're driving, is there plenty of parking? Can you get a student parking pass? Is the canteen open when you're on shift? These are all things to consider before you start, and definitely don't leave it till the night before. My fourth tip is be prepared. Get everything ready the night before of the things that you actually need to take with you. These are some of the common things you need to bring on placement. Most important being ID badge and uniform, but you can plan yourself what you need to take. My fifth tip is to make sure you get an induction of your placement area as soon as possible. It's important to find out about fire procedures, where the emergency equipment is, where you can get drinks or store food, who will you inform if you needed to call in sick. The important things you need to be aware of will vary depending on your placement area, which is where your research will also be beneficial. Most placement areas will make sure you have a thorough induction when you start, but if for any reason it gets missed, make sure you ask. My sixth tip would be to seek out learning opportunities. Be confident, you're there to learn, so don't worry if you don't know everything. If you're struggling with confidence or getting involved, let somebody know. Ask to observe and try and observe a clinical skill being performed before you try yourself. Don't be disheartened. It's not always possible to observe or be involved in everything, but don't let that put you off asking again. My seventh tip would be to arrange to work with as many different staff on placement as possible. You can ask to work with different teams connected to the placement area as well. So, for example, if you're on placement with the community mental health team, you could arrange to go to the depot clinic for the day. If working on a ward, you could ask to shadow the clinical nurse specialist or other healthcare professionals such as physio or dietitians. My eighth tip would be reflective writing. Reflection is encouraged throughout nurse training and increases learning and development. Reflective writing pieces can be used as evidence for certain competencies that you have to complete. And it's also a requirement of the NMC for revalidation when you become qualified. So it's an essential skill to start developing straight away. My ninth tip would be talking to patients. Sometimes you feel like you've got so much to learn on placement, you want to spend all your time with experienced staff who can teach you clinical skills, which is obviously a massive part of the experience. But talking to and caring for patients directly, making them feel safe and supported, is one of the foundations of nursing care. My 10th and final tip is self care. You can't look after other people if you aren't looking after yourself, which is why self care in nursing is so important. If you're finding something difficult or you have a concern, you need to speak to somebody. Take breaks and stay hydrated. It's easy for these things to get missed in busy, very busy working environments. So make sure you allocated break times and take them. If you have your own health needs, you need to prioritize them and tell staff you're working with so you can be offered support you might need. Thank you for watching. I hope these tips will come in useful for any upcoming placements you might have. If you have any of your own tips, please leave them in the comments below.